Did you know that there are countries that allow abortion or accept abortion to be done? And there are countries that do not accept abortion at all. In other words, the countries that do not accept abortion outlaw abortion. Therefore, it is important that the information that KAREEM'S clinic wants to deliver today would help people who would want to procure safe abortions, especially in countries that allow abortions. Either way, even in countries that do not allow abortions, people die. People die while procuring abortions because they are using unsafe methods. A lot of people choose medication instead of medical procedures to procure abortions. But are pills or medications safe for abortions? Yes, they are safe. Globally, one important and most commonly used medication is called Misoprostol. Misoprostol is used to terminate pregnancy. Originally, however, this medication was meant to treat ulcers. How? Why? The medication helps the stomach lining from getting damaged by the acid that is produced. In other words, Misoprostol, apart from just making somebody to procure abortion or terminate a pregnancy, will reduce the stomach acid, will decrease the quantity of the acid that is produced by the stomach. When it comes to the uterus, the effects of Misoprostol in the uterus, it makes the uterus soft, and also it leads to dilation of the uterus and contraction of the uterine walls. When the uterine walls contract, that is when everything that was within the uterus or womb is pushed out. And that is what we call abortion. If there was a child, if there was a fetus in the stomach, it will be pushed out. And that is the effect of what we call Misoprostol. How effective is it? It is 90% effective when used. And I repeat this, when you use it during the first 10 weeks of pregnancy, it is 90% effective. But if you want it to be even more effective and to increase the efficiency, then you will combine it with another medication called Mifepristone. Mifepristone, locally, it used to be called RU486. This Mifepristone, I would say, do not use it alone. Use it only with the combination of Misoprostol. However, you can use Misoprostol alone because it functions to extract the content of the uterus out. It will expel everything in the uterus. That is Misoprostol. But this one does not do the expulsion. What does it do? It simply interferes with the pregnancy hormone called progesterone. Progesterone is that hormone that is present when you are pregnant. What does it do? It makes the uterus thicker and safe for the baby to stay in. The lining of the uterus will be thick and the baby will be well supported. That is, the embryo that is growing will be well supported. And this same progesterone always makes sure that the entry, the exit or the entry or the opening from the cervix that leads to the uterus is always closed so that nothing comes out. So the only way that Mifepristone work is by stopping the production of progesterone. So if the production of progesterone is stopped, what happens next? The opening will not close, meaning anything can come out. And also the walls will be broken down. They will not be the thickening. The thickening will be scrapped off. So if that happens, then your guess is as good as mine. The walls the walls come out to expel the baby. And remember, the door is open, the cervix, the opening at the cervix remains open. So a combination of these two medications would help a great deal in terminating a pregnancy. And what pregnancy? The age of pregnancy? That pregnancy should not be more than 10 weeks for this to work perfectly well. 10 weeks, about 70 days and below. Somebody is asking, are there any side effects? Yes, there are, but these side effects will subside within 2 days. Will be okay. You will experience bleeding as usual. You will have to bleed because there is something coming out of your inner parts. You'll also have a little fever and diarrhea. Now, not everybody will have fever and diarrhea, but bleeding is meant for everybody that will use the two medicines to end a pregnancy. Once again, I would say that if you have a doctor who can prescribe the medication for you, it's okay, but I will do the prescription in the next video so that you get to know how to use these two medications well. That is the information that we had, and for those that get this information today not in line with your faith, I say sorry. I would apologize. However, this is for medical purposes. No faith here. There are people who procure abortions and they die. So for safe use, kindly follow the instructions. That is all the time that I had for us. If you find this video useful, consider subscribing. Thank you. I wish you the best of health.